this is Jacqueline from Lichen Sclerosus Support Network, where our mission is to empower people with lichen sclerosus by providing evidence-based education and support so that we can live in a world where those affected by lichen sclerosus are informed, educated, and get diagnosed earlier. If you find the information in our videos helpful, please consider donating your time or money so that we can continue our education and support efforts. So in today's video, we are going to talk about a highly requested topic, which is remission and lichen sclerosus. So we're going to talk about what remission is, how do you know if you're even in remission, and can you have symptoms if you're in remission? We're going to address those questions in today's video. And don't worry, in our next video, we're going to be talking about what you can do to get into remission. So if you enjoy the content in this video, be sure to give us a like. Be sure to subscribe to our channel so you don't miss on any other LS content, including the next video, which is going to talk about how to get into remission. So with that, let's jump into things. All right, now before we jump into what is remission, we need to have a quick chat about a very important distinction in the world of lichen sclerosus, and that is the difference between signs and symptoms. So I do have a longer video on this. If you're really curious and want to check it out or take a deeper dive, I'll pop a card up there and you can check that out. So we're going to just go over this a little more briefly, a little bit more succinctly. So a clinical sign is essentially something that you can physically see, either you or your healthcare provider, when looking at the vulvar skin. So things we can see, just to give a couple of examples, are changes to the color of the skin. So in the context of lichen sclerosus, we're often talking about the loss of pigmentation, so areas where the skin is getting lighter and lighter. Another clinical sign might be a change to the texture of the skin. So there may be areas of the skin that appear thicker, more raised maybe. Some folks have an appearance of kind of wax, crinkly paper, right? So textural changes, these are things that we can see. We may not necessarily feel them, but we can see them when we look at the vulva. Now, symptoms, on the other hand, are not things that we necessarily see, but they're things that we can feel. So this is more on the patient side of things. It's what we feel in our bodies. So examples of these would be things like itch and pain. So think about it this way. If somebody is examining my vulva and I'm really, really itchy, they can't physically see that itch. Maybe they can infer that I'm itchy. So if there's evidence of a clinical sign, right? If there's a sign that I've been scratching my skin, right? Sometimes when they're looking at the vulva, they can tell when we've been scratching a lot. There's kind of hyperpigmentation, so more pigmentation that kind of looks like we've been scratching. They might be able to infer by that we may be itchy, but they can't physically see itch on the skin. Same thing with pain, right? We might be in pain, but they can't physically see that pain. The pain is something that we feel. Again, pain could be inferred by certain signs that they see. So if there's a lot of redness and the skin looks really raw and inflamed, the doctor may assume that there's pain based on the clinical sign, but pain itself is a symptom, okay? So you're gonna see why this distinction is very important in a moment when we're gonna hop to the next little clip and talk about what remission is. All right, the question that almost everybody wants to know, what is remission? What does that mean? It sounds really good, but what do we mean by it? This is a really good and really important question for you to have an answer to and to be informed about. So in the world of lichen sclerosus, especially with those who are LS specialists, when they talk about remission, they're talking about something called clinical remission. Now, what that essentially means is that there are no active signs of lichen sclerosus. So that's where that little symptom sign thing comes into play. But let's break that down. No active signs of lichen sclerosus. What does that mean? That essentially means that there are no new signs that indicate that the lichen sclerosus is active. So remember that signs are things that we can see, either us or a healthcare provider. They're things that can be seen on the skin. So if the skin texture looks pretty good and healthy overall, if there's no new discoloration, such as the loss of pigmentation, if there's no new scarring, and by the way, scarring is kind of the medical way to refer to those anatomical changes, or what's also known as architectural changes. So think about things like fusing. That would fall under the category of scarring. So if there's no new scarring and the tissue overall is looking good, then you would be in clinical remission. Okay, great. But how do you know if you're in remission? Can I determine it myself? Like when I go do my vulva check, can I look at my vulva and be like, super, I'm in remission? No, not really. So to know if you're in remission, it's really going to be a trained and specialized healthcare provider that can make that call. So sometimes general physicians, primary care physicians, they may not be specialized enough to make that call. They may or may not, it depends. There are some general providers that take a special interest in vulvar conditions, and so they may actually be quite informed, sometimes not so much. But it does take a trained specialist to examine the vulva and examine it over time and determine when the patient is in remission. The reason I say that it's a healthcare provider that's going to make that call is the following. When I examine my vulva here at home, I basically lie on my bed, I'm reclined, I have a little mirror. If you've watched my vulva check video, which I'll pop up there, you've probably seen that mirror that I use. I have a little headlamp that kind of looks like I'm a miner or something. So I have my little headlamp and I angle the light so that the light's kind of shining on my vulva on the thing, and I'm propped up on my pillows and I'm looking around. But here's the thing. My eyes are only so good, right? I don't have the kind of specialized equipment nor training to really get a proper look at the vulvar skin and make that call. A lot of times I've heard this, it's very common where people look at their vulva and they're like, great, there's no problem areas, things are looking good, I think I'm in remission. And then they go to see a specialist who has very specialized equipment, right? Mine, I don't know what it's called exactly, but one of my gynecologists has this thing that he literally like puts on his head. Looks like a huge Explorer. It's a really big device, and it basically allows him to get a way more fine-grained, more detailed view of the skin than you ever could with just your eyes alone, right? It's like a really intense magnifying glass or microscopes. Think of it like that. So they can really get in there and see all of those little details. And so what I've heard is people saying, oh yeah, I thought my vulva looked great. And then I went to the specialist and they said that, you know, the majority of the skin looked well, but that there was this little new patch of hypopigmentation. So there was some loss of pigmentation and a little bit of skin thickening on the left side. And they said, you know, it's wild. I didn't even see that with my own eyes. And that's because if the changes are really small, our physical eyes may not be able to detect it. And that's why at the end of the day, it's really a specialist that's going to be able to make that call, whether or not you are in remission. All right, now at this point, you've heard the definition of remission. You've heard me talk about who's going to determine if you're in remission. And you might be wondering, wait, you've only really talked about signs. What about symptoms then? Can I still get symptoms in remission, or does remission mean no symptoms? This is a really good and really important question. So if you are in remission, most people will either have a reduction of itch, so they might have some lingering, mild and sporadic itch, or no itch at all. The itch factor typically really improves, if not completely goes away, when you are in remission. However, the other symptom, which is pain, and by the way, when I'm talking about pain in this video, I'm talking about it as a very broad category. So pain can be anything from tingly, sharp pain, stabbing pain, achy pain, soreness. It can be burning. It can be stinging, any kind of pain. When I just use that word, I'm using it to encompass all of those types, just to keep things simple. Now, unfortunately, it is possible to still experience pain when you're in remission. Now, one of the reasons for this is that when you're in remission, you may still have scarring. So remember that scarring is things like fusing, things like the labia majora and minora fusing together, things like the clitoral hood fusing over the clitoris glands. There can be fusing and scar tissue buildup at the opening of the vagina, right? And so what we know about steroids is that they're very good at helping to manage symptoms, at slowing and controlling the progression of LS, of reducing the likelihood of developing vulvar cancer, of getting into remission. The one thing steroids don't unfortunately do is they don't reverse any scarring that has already occurred. Okay, so for example, my labia minora has completely fused to and resorbed into the labia majora. So I don't really have any inner labia left. There's like a teeny little bit near the clitoris. That's it. The rest is completely resorbed. And I've been using steroids for probably a little over 4 years. I'm not the greatest at math and numbers. People who've been following me for a while know that. So always take my numbers with a little bit of a grain of salt unless I'm quoting a statistic. But so a little over 4 years, and steroids unfortunately slowed the progression. So I haven't had any new fusing since. However, it hasn't reversed. So it didn't help me undo the fusing that's already occurred. Now, why this is important is that fusing, that scarring, can in some cases lead to persistent pain, even if you are in remission, because remission is about no new signs. So let's say I had scarring, I lost the labia minora, and I had some scarring of the clitoris. Now, with steroids alone, we're not going to undo that, but I can still be in remission as long as there's no more new fusing. So if I go to my next gynecology appointment and she noticed that there was a lot of new fusing at the entrance of the vagina and some scar tissue buildup, that would be a new sign, and that would indicate that I'm no longer in remission. So unfortunately, because steroids don't reverse that scarring, if you have residual scarring, that can sometimes lead to pain. Now, commonly, this is going to be pain with sex and recurrent tearing. And if you want to learn all about what you can do with if you experience recurrent tearing, we do have a video on that. I'm going to pop that up there. We also do have a bunch of resources on how to unfuse your clitoris, both surgically and unsurgically. So I'm going to leave all of those in the description box below. So definitely be sure to check those out. But for the time being, what happens is because there's scar tissue buildup at the opening of the vagina, that scar tissue is very thick, it's very rigid and hard. It doesn't have much give nor any elasticity. So when you try to insert something, that area will tear open. And what people can experience is recurrent tears. So they tear open, it scars back over, they try to insert something again, it tears again. And that constant tear, heal builds up more and more scar tissue, causing the person in question pain. Another thing that can happen sometimes is nerve sensitization. So you get into remission, but the nerves are almost hyperactive, and they're amplifying signals to the brain saying, whoa, hey, we're in a lot of pain, brain, when actually there's not, and there's no injury, but the nerves and the signals that they're sending are being confused and amplified, and that can sometimes lead to pain. So because of scarring and because of what can sometimes happen where the nerves get kind of overactive, and we are going to have videos on nerve pain and lichen sclerosus and central sensitization and what you can do about that in 2024. So again, be sure to subscribe to our video to check that out. But suffice it to say, there are a number of reasons why there still can be a pain component when you are in remission. So remission, to be clear, doesn't necessarily mean no symptoms. Now, even though remission doesn't necessarily mean no symptoms, you absolutely can experience no symptoms in remission. And in fact, a lot of the people that I know who are in remission no longer have a pain or itch component to their LS. They are very, very happy. Their quality of life has improved, and overall, they feel like themselves again. And this is my experience. So, it's always a little bit weird because I record these in advance. So by the time this goes live, I'll probably be like 3 years and 7 months or so in remission. So I'm coming up to 4 years in remission. And ever since I got into remission, I don't have any symptoms. So that's almost 4 years where my skin has been in remission, and I have had no itch, no pain, no more tearing with sex, which was a big one for me. No more fissures, which was a big one for me. Pain with sex, tearing with sex, and fissures were my main symptoms. And those all kind of went away. So I am very, very grateful for this. I acknowledge that this isn't everybody's experience, but I'm incredibly grateful that it is for me. And I just want folks listening to know that, there are people who have been in remission for 5, 10, 20 years who tell me they also haven't had any symptoms. But I do just want to make that point clear that it is possible to still have some symptoms while in remission. It's typically milder, but it is possible. I just want to say that to kind of validate those who have been given a diagnosis of remission and nonetheless they're like, but I still itch sometimes, but I'm still kind of in pain, or I don't feel perfectly symptom-free. So that is possible. All right, so before we close out this video, I do just want to note one more important thing, and that is that not all doctors will use the word remission. Now, why that is, I don't really know. They probably all have individual reasons for why they don't use it. That can be a bit frustrating for the patient because it's like, well, we don't know where we stand. Like, am I in remission? Am I not? Is this a mild case? Is it a moderate case? Is it severe? How am I looking? Like, give me some kind of guidance on where I'm at, right? At least that's something that I like. Most people that I talk to want to kind of know where they're at, whether they're in remission or not. They kind of want to get a sense of how they're doing. So first of all, some doctors, instead of using the word remission, will say, your skin looks so good. There's no active signs of disease. Now, remember that no active signs of disease is essentially the definition of clinical remission. So if you say that, it's quite likely that the skin is in remission. Another thing they may say is, wow, your skin looks so good. You would never, ever, ever know that you have lichen sclerosus. It's so well maintained. I can barely tell. It's only because you're my patient that I know. That there, again, might be an indication. Now, if your doctor says something like this and you just want to know, you have every right to say, hey, does that mean I'm in remission? Just ask them. Now, some doctors, again, it might depend on their specialization, right? So if they're not super specialized or an expert in this field, they just may not feel comfortable giving that answer to you. That's very much a possibility, right? That said, it can't hurt to ask. It really can't hurt to ask. So always, if you're not sure, if they don't use the word, and remember, some people use different words to refer to the same thing, which can be really confusing. Just to give a quick example, labial resorption and labial agglutination, they mean the same thing, right? But some doctors use different terms. So they might use a different term and say, hey, does that mean I'm in remission? You can just straight up ask them. So I just wanted to note that because some doctors won't use that term when talking to their patients. So I just wanted to flag that and remind you that you can always ask them if you want to know.